Do you ever feel like you're running on a pebble, but look in your shoe and it's empty? That burning, tingling, or stabbing pain like you're stepping on a pebble in the ball of your foot might be Morton's neuroma. If you're over 35 and a runner, you're more likely to deal with this condition. And the good news is you can catch it early and fix it without completely wrecking your training or stopping your training. In this video, I'll show you exactly what Morton's neuroma is, how to self-diagnose it, and what to do next to start healing and running stronger without a pain in the ball of your foot. Morton's neuroma is a thickening around a nerve, usually between your third and fourth toes, that is caused by repetitive pressure and irritation in the foot. Some common symptoms include a burning, tingling, or numb sensation in the ball of your foot, a rock in your shoe feeling that just doesn't go away no matter what, pain that worsens with tight shoes, long runs, or pushing off of your toes. Just so you know, it's not a tumor, even though it has the name neuroma. It is a nerve that is angry and inflamed. So, how do you self-diagnose Morton's neuroma? Here are 3 easy tests you can do right now to check and see if it's probably that Morton's neuroma. Number 1 is a squeeze test. You're going to sit down, cross your foot over your knee, and squeeze your forefoot side to side, like you're pinching the ball of your foot together. If this recreates the burning or tingling sensation or sharp zap, it's likely a neuroma. Number 2 is the toe compression test. You're going to press directly between the third and fourth toes on the ball of your foot, if that's where you're feeling the pain. Like I said, that's the most common place. But if you feel a pain, buzzing, or shooting sensation, also another clue that it's likely Morton's neuroma. Third, finally, you're going to do some run or walk feedback. Do you feel the pain? Pay attention to when you're running or walking. You're going to look and see if you feel the pain worse during push-off or after longer runs. If it goes away at rest but flares with activity, that's kind of the classic Morton's neuroma behavior and sign. Something important to note, this can often be confused with metatarsalgia or stress reactions, so if symptoms don't improve in 2 to 3 weeks from some of these exercises, make sure you see a healthcare professional like a physical therapist like me for a true diagnosis and to see if there might be something else going on. So why are runners over 35 more susceptible? As we age, several factors make us more vulnerable to some of these conditions. Like the fat pad under our foot, it naturally thins out. Then you have years of running with cumulative pressure on that forefoot, causing some inflammation and some changes there. Hormonal changes and poor foot mobility equals more nerve compression. Make sure to check out my daily foot mobility routine for runners. I'll link it above to kind of help with some of that mobility. And then also footwear mistakes. Narrow toe boxes in your shoes, minimal support. I like minimal support, but if you're also combining that with narrow toe boxes and other things and your day-to-day shoes really put a lot of pressure on the ball of your foot, that's going to likely have some problems for developing Morton's neuroma as a runner. Something that you can do quick to kind of relieve this pressure and keep running is to add some metatarsal pads behind the ball of your foot, not directly where it hurts, to reduce the pressure that is going on right there on that nerve, so you can keep running without as much pressure and pain. So never put it directly under the pain point. The biggest question, the number 1 question everyone wants, can you keep running? Yes, you can keep running, but you need to train a little bit smarter, be more aware of what you're doing. So some of the ways that you can modify your running without making a Morton's neuroma worse is reduce your speed workouts, your hill runs, and the longer mileage runs temporarily to kind of let it heal. You want to stick to softer surfaces such as the treadmill or the track just to reduce that pressure and irritation. Use a walk-run strategy. Run 4 minutes, walk 1 minute, 5 minutes, 1 minute. However you want to do it, just to kind of change up what that constant repetitive pressure is on the forefoot, on the ball of your foot. And then don't run more than 3 times a week while your symptoms are present. My biggest training hack for modifying is cutting weekly mileage by about 30% and adding an extra recovery day between your run sessions will really help decrease and modify and hold you back a little bit in a good way to let your foot recover. So let's look at what a 1-week start of a recovery plan would be for Morton's neuroma. We want to reset your feet with mobility, with strength, and with some footwear changes. So number 1, daily mobility. Work on toe spreads and squeezes, a towel scrunch, toe yoga. You're going to lift the big toe, keep others down, then reverse. You want to do that daily. Then we want to work on strengthening about 3 times a week. We're going to work on calf raises on the ground, some short foot activation or doming, seated foot doming with a band. This one's a little bit harder. If you don't have a band, don't worry about it. It's something else that it's just a good alternative to the short foot activation. Then finally, footwear fixes. Change up your shoes. Use wide toe shoe boxes such as Ultras. Avoid heels, flip flops, or pointed shoes day to day life. And make sure you have more than one type of shoe that you're running in, that you're alternating between. If you want this full week 1 plan for free, make sure to check the description below. I'll link it down there for you. Okay, so some bonus tools to help speed up recovery and just kind of keep you running a little bit more. These are important. So if your foot still feels on edge, these are some supportive tools that you can try that can help, but just don't test these on race day, okay? Toe spacers. I love my toe spacers. I'll link my favorite ones below, but wear them 5, 10, 20 minutes daily just to kind of help stretch things out. The orthotics with metatarsal support, they're always helpful. Massage tools like a massage gun, I'll link my favorite one down below. Sometimes that CBD cream or something like that you can use if it's all right with your primary care doc and your pharmacist, that type of stuff. Use those external tools just to help calm things down a little bit more, but they're not a fix. And remember, if your pain isn't improving with a lot of these strategies that I mentioned above, not the extra tools, after 3 or 4 weeks, make sure you consult with a running PT to really see what's going on and see what we need to actually fix. So if you've been running through foot pain for months, or maybe just a few days, maybe it just started and you're trying to be proactive, then this is your sign to stop guessing and start healing now. Be sure to download my free 1-week Morton's Neuroma recovery plan, or if you need more support, apply for one-on-one coaching if you want my expert eyes on it. It's 100% virtual, and I will take you through the full treatment plan, customized one-on-one support. Make sure to like and subscribe for weekly tips and to help you run pain-free after 35.